Hi, we're going to show you the procedure for the insertion of the IGel supraglottic airway. Now, first thing we do is we apply a little bit of water-soluble lubricant onto the tray of the IGel. And we want to take the IGel and lubricate it on the tip, the distal tip, and the sides, along with the posterior back. And next step is to hyperoxygenate the patient, because it's the same manner as if you're going to intubate. And once you've hyperoxygenated your patient, we want to suction the patient if necessary. If everything is good, then we want to position the head in a sniffing position or a neutral position. Then we take the IGel and we hold it in the dominant hand. We position the tip of the IGel at the hard palate of the jaw. We're going to take the non-dominant hand and push down on the jaw. Slide the IGel in following a backward and downward motion until we feel resistance. Once we feel resistance, we want to secure the IGel in place with the supplied strap. It's not necessary to have a pre-manufactured strap for this, because all we need is downward pressure holding the supraglottic airway into the position that we needed. Once we put strap the IGel in securely, we can put in a CO2 detector, either the electronic waveform or the paper form, whichever your protocol dictates. Then we bag our patient. You can see the lungs are inflating, so we're in the right position. Now, there's other things that we can do if we come across a couple of problems. Here we have a supplemental oxygen port. We can take supplemental oxygen, add it to the patient while we're bagging. So this will give extra oxygen if you have a low volume regulator that you're working off of. You can do supplemental off of another one. Another thing, if you feel resistance for lung compliancy and you need to alleviate pressure from the diaphragm to get good compliancy, we can use a NG tube, adding a little bit of soluble lubricant on the tip, and you can put it right on the IGel device itself. The port is here. We can introduce the suctioning into this port, and it will go all the way to the end. The tip has a hole that goes right down into the epigastrum. And we can put that all the way down in there and suction our patient as needed. The whole time we can be bagging the patient with supplemental oxygen and suctioning. Still have good lung capacity. The couple of things to remember: we don't want to put excessive force on the device while insertion, and it's not necessary to put any fingers or thumbs inside the mouth while doing this. Once you feel resistance, you pop it in there, you're in a good position. If you can't get good compliancy with bagging at that point, you might want to try a little modified jaw thrust to aid in the placement. Other than that, we're good to go. Right? If you have any questions, contact your training supervisor or your shift supervisor for any further instructions. Thank you for watching.